Then it goes.
Mm-hmm.
Good morning, Chairman. We're ready to begin.
Good morning, Denisha. If you'll call the roll of board members, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Cynthia Rucker,
Here.
Tommy Hopkins. Tommy Hopkins. David Cruz. David Cruz. Anthony Williamson.
Here.
Shane Mobley.
Here.
Robert Coles.
Here.
Kathleen Ruth.
Here.
Chairman, we have a quorum, and that concludes my roll call.
Thank you, Denisha. We do have a quorum, so we can conduct business. So the meeting is hereby called to order. We have 2 items for final adoption this morning, and we have 2 items for initial adoption. And we'll proceed. Without Dr. Hopkins present, you have been sent the minutes. We will take a look at the minutes and entertain a motion for approval.
Motion for approval.
Have a motion for approval. Do I hear a second?
Second, Williamson.
Thank you, Anthony. We have a second. Any corrections or additions? Hearing none, all those in favor of the motion signify by aye.
Aye.
Aye. Aye.
All opposed, no. Motion carries, so the minutes are approved. My opening comments are very brief, of course, this morning. First of all, wish each of you a happy new year. We've arrived in 2025. It sounds like something from science fiction, but here we are. And I know we want to acknowledge that today is a day of mourning and remembrance for our 39th president, President Jimmy Carter, and a fellow Georgian. We also want to acknowledge and probably pray fervently for all of our friends in California that are so devastated by the fires that are occurring as we speak. And also advise all of you to be mindful and cautious as we approach the incoming weather for tomorrow. We were discussing earlier, it looks like particularly North Georgia will receive a good bit of snowfall. We may have a good bit of ice down in middle Georgia. So everyone be careful in that. On a more positive note, this board has the ability to do much good in 2025, and I encourage us to do so. And I also want to extend a great deal of gratitude to all the members of the Department of Community Health for all you do every day to provide help to our fellow Georgians. With that, we'll move on into our business. Commissioners, well, first we'll have a committee report. We had a care management committee meeting this morning, and we'll ask Anthony Williamson to give us an update on that.
Thank you, Chairman Folsom. We did have a good care management committee meeting this morning. We principally had one agenda item that Brian Dowd, our Deputy Executive Director of Medical Assistance Plans, shared with us. And it was an overview of the program of all-inclusive care for the elderly, which has the acronym of PACE. I think this is something we'll be hearing more about. It's going to be perhaps part of our future a little bit down the road, but essentially This is a capitated type plan, alternative care plan for Medicare, Medicaid patients. There are roughly 30 other states that have gone live with these types of programs, and Georgia is now positioned for that with the legislation that was approved in 2024. These types of programs are aimed at patients who essentially meet the care requirements for nursing homes, but must live in their own home and remain in their community. Through the capitated payments from Medicare and Medicaid to the PACE organization pays for all of the care that these patients then who choose to enroll in PACE that they require. That includes all ambulatory care, doctor's visits, any hospital care, medications, DME, et cetera. Very comprehensive. So we were able to hear about these from Brian. Very interesting report. There was, with the approval made by the governor, there was $2 million in grant money that was approved that went to 3 organizations that are perhaps going to establish PACE outlets within the state. These are centers that will be located in certain geographies. They'll study, where it makes sense to have these types of centers established, which zip codes, et cetera, will be serviced. Medicaid payments to the Medicaid capitated payments to these PACE centers are somewhat historically, based on the historical utilization of Medicaid patients in nursing homes, but aim to be a little bit less. So should be a savings to the state in terms of the Medicaid outlay for the patients who choose to enroll in the PACE program. And next steps include policies are currently being developed, per diem rates are being finalized. There will be an amendment that needs to be filed with Medicare and CMS, RFP process. So we're probably, we asked, Brian, what he thought about in terms of timeline. Probably sometime in early, if not mid calendar year 2026, before we might see some of these PACE organizations begin to stand up with enrollees in the state of Georgia. Typical PACE provider has somewhere between 100 and 150 enrollees in order for them to be successful. And he kind of finished up the presentation by focusing on how the enrollees in these centers will now have a level of care management, afforded to them that really is something that we see more, provided to the family Medicaid enrollees, that are cared for by our CMOs. So it's could be a really good opportunity for state enrollees who typically are getting Medicaid because of age, blind, or disabled to get some additional care management type activity that they're not getting today. Some good questions from our board members during the presentation, and that was the end of our care management committee. Very informative presentation by Brian on this program.
Thank you, Anthony. Any questions for Chairman Williamson from any of the board members? Thank you again, Anthony, for that report and the meeting. We'll move now into the commissioner's report. So Commissioner Carlson, good morning.
Good morning, Mr. Chairman and members of the board, everyone watching at home. Mr. Chairman, I guess it's a good sign with your tenure as chairman and mine in this role that we're already of like mind. And your comments, not only did you touch on several things that I'd written down. We actually did them in the same order as, I couldn't help but notice that we're having this meeting today, as you mentioned, the backdrop of President Carter's, funeral happening as we speak at the National Cathedral, and he'll make his way back to Plains this afternoon. And just like you mentioned, Mr. Chairman, he gave us a lot to emulate as we think, on the new year, how we might be able to be public servants, and recognize our full potential in our personal and professional and civic life. So I'm of like mind with you, Mr. Folsom, that I'm very mindful of the Carter family and that legacy. Also, like you mentioned, we're conducting this meeting today in the backdrop of a lot of destruction and pain in general happening in California. A lot of families displaced and may not have anything to come home to, and obviously the first responders involved that are literally running into the fire, and in challenging conditions with the wind and just the unpredictable nature of that. That was on my mind as well, Mr. Chairman. So we're already finishing each other's sentences, if you will, but I think that's a lot, because those are two things that I think should be on everyone's mind. And to follow on what Mr. Chairman said, in reference to the storms, we are mindful of that. Governor Kemp has already asked state agencies to work virtually, remotely tomorrow. For buildings in North Georgia anyway, will be formally closed, and that will apply to DCH here in Atlanta and Norcross, the Katie Beckett office in Norcross. But we will be on the clock, if you will. So for any families and customers, if you will, watching at home, you will be able to get questions answered, services rendered, but we will not be here in person. So hopefully everyone can stay off the road where DOT can prepare and keep everyone safe. And obviously we expect some school closures, and everyone can stay home with their families on relatively short notice. But before we move to our agenda today, Mr. Chairman, if you recall last month, our December meeting, we took some time to honor our friend, Mr. Boyd, with his retirement from the chairman's role. And that was time well spent. We enjoyed doing that. So if as we pivot to the employee milestones, which I think we all enjoy taking some time to do, I'm going to encompass both the December and January milestones. And we'll kick it off with some doozies here, a couple of 25-year milestones for December. And there are a few coming in January also. For the 25-year mark, Annie Ruth Parks at the boards of dentistry and pharmacy, and Carrie Carter at MAP, 25 years. Can't thank you guys enough for your service. We have a 10-year in financial management, Mavia James. Couple of 5 years, Carrie Gibbs at SHBP, and Kim Morris at financial management. Thank you both. And kicking off our 1 year acknowledgements, which I think are equally important to thank these team members for joining the fun. I'll start that off with Emily Yona here in the Commissioner's office. Thank you, Emily, for all you've done in a short amount of time. Chancellor Lester in the IG's office. Mustafa Jackson, financial management. Luana Marcius in OPI. Ashley Bellino, MAP. Shawnette Mims-Jones, MAP. Bhavin Patel, SHBP. And Maya Jensen in health planning, all 1 year. And we thank you guys for your contribution to the team. Moving to January, I have a couple more 25 years and some 20 years. Arlene Hawkins, Inspector General, 25 years. And our dear friend Kelly Washington, HR, that makes so much tick around here, not only on the blocking and tackling of HR and vacancies and finding good candidates, but the curriculum that they put forward in our professional development. the events that they take to honor different divisions at relevant times. Kelly, 25 years, and we're grateful for all you and your team do. Couple of 20 years, Emma Ross Bouquet and MAP, Dejong Chong and IG, 20 years, both 20 years. Therese Briscoe and MAP, 15 years. Couple of 10 years, Beatrice Ramos in Financial Management and Brandy Finley in Inspector General. Some 5 years, Betty Williams, HFRD. Shauna Johnston, Financial Management, 5 years. Latrice Thornton, HFRD, 5 years. Tisha Crow, IG, 5 years. And again, our 1-year members, Vicki Templeton, General Counsel's Office, Unique Gray, OPI, Arlisha Bean, MAP, Paris Nunez, MAP, Maxine Elliott, 1 year at MAP. Thank you, Maxine. Shanique Horn, MAP, 1 year. Tisha Ward, MAP, 1 year. Medina Brown, SHBP, 1 year. Ebony Hart, HFRD. Susie Johnson, HFRD. Carla Chavez, HFRD. Chantel Crawford, HFRD. We all knew they'd been recruiting, so I think there's evidence there. And Caleb English at the Georgia Drugs and Narcotics Agency. Thank you all for there's so many names on here that, again, this comes up a lot sometimes. Lynette, you and I have laughed about this. Some of these guys come up on that 1-year mark, and as active as they are, it seems like they've been here a lot longer. So I think that says a lot about their contribution and their activity here at the department. So like we say a lot of times, these things don't just happen on accident. There are a lot of good people putting in so much time, often when no one's looking, and we're very grateful for their contribution. These are big lifts going on around here, as was evidenced in the PACE discussion this morning that Mr. Williamson mentioned. That's been a long process, a complex process, and there's a lot of work left to be done. So we thank everyone for their contribution and thank everyone in advance for their work that will be required for the legislative session, which is set, Mr. Chairman, to begin Monday. Will last 40 legislative days. Hopefully, they'll continue putting out a calendar for those 40 days at the front end session so we can all be motivated by the fact that we know the end date. That always helps with morale. As you put in those long days, you can at least point to that day in March or April that you know business will be wrapped up, at least on that front. So, Mr. Chairman, thank you for giving me the time to acknowledge those milestones, and I'll hand it back to you for the business at hand. Thank you.
Thank you, Commissioner. We certainly want to acknowledge those employees you named too. That was a tremendous amount of service to the state of Georgia you just went through there.
No question.
We'll move to our first item of business. Melanie Simon, our General Counsel, will present to us on rules and regulations for general licensing and enforcement requirements. Melanie, the floor is yours.
Good morning, Mr. Chairman, Commissioner Carlson, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption. These rules pertain to general licensing and enforcement requirements, and they are found in Chapter 111-825 of the Department's Rules and Regulations. The purpose of these rules is to establish an annual license fee in the amount of $800 for adult residential mental health programs. As you may recall, this is a new facility type that was established under Georgia law, and in November, this board approved the rules specific to these new programs. It is our goal to be able to implement this and issue licenses for this new program effective July 1st of 2025. An opportunity for public comment was held on December 17th at 11 a.m. via Zoom, and written comments on these revised rules were due on or before December 20th, 2024. No comments were received during the public comment period. As such, we are requesting consideration for final adoption of these rules by the board today, and I'm happy to answer any questions.
Any questions for board members of Melanie? Hearing none, we'll entertain a motion for approval of this for final adoption.
Dr. Coles, motion to approve.
Dr. Coles has made a motion for approval. Do I hear a second?
Second, Kathleen Ruth.
Dr. Ruth has seconded, and we'll call for the vote. All those in favor by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Sounds like unanimously. Melanie, you can proceed on to the next item. Thank you.
Thank you. The next item is a request for final adoption consideration for rules and regulations for hospitals. These are also being presented on behalf of the Healthcare Facility Regulation Division, and these rules are found in Chapter 111-840 of the Department's Rules and Regulations. These revised rules remove the requirement for an order or referral for screening mammograms. An opportunity for public comment was held on December 17th at 1 p.m. via Zoom, and written comments were due on or before December 20th of 2024. We received no oral comments, but we did receive one written comment from Carrie Connolly, the General Counsel and Chief Policy Officer of the Georgia Hospital Association. Ms. Connolly remarked, on behalf of the 150 members of the Georgia Hospital Association, they expressed support for the proposed rule change, noting that the revised rule aligns with federal requirements and will help increase patient access to preventive care. We thank Ms. Connolly and the Georgia Hospital Association for their comment and for their support of these revised rules. As such, we are requesting final adoption of the rules today, and I'm happy to answer any questions.
Any questions for board members of Melanie? Hearing none, is there a motion for approval?
Mr. Chairman, this is David Cruz. I move for approval, and I just let you know I did join the meeting just a little late.
Thank you, David. And for the motion for approval, do we hear a second?
Second, Dr. Rucker, and this is excellent. I just wanted to say it opens up access. This is a big need, and I'm happy to hear this.
Thank you, Dr. Rucker. We have a second. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion is approved. Melody, we'll go to your final item, rules and regulations for the criminal background checks.
Thank you. These rules are presented today for initial adoption. These are the rules and regulations for criminal background checks found in Chapter 111-812 of the Department's Rules and Regulations, and are presented today on behalf of the Healthcare Facility Regulation Division. These proposed changes add adult residential mental health programs to the list of facilities that are subject to the requirements of the long-term care background check program. This is a change mandated under state law pursuant to OCGA 317-351-8H. Under this law, effective July 1st, when the new licensing entity is established by HFRD, the owner, the administrator, and the direct care staff of these adult residential mental health programs will require a fingerprint criminal background check. The public comment hearing for these rules will be held on January 28th at 11 a.m. via Zoom, and written comments will be received on or before 5 p.m. on the same day. And pending the review of those comments, we plan to bring these rules back for final adoption at the February board meeting. I'm happy to answer any questions, and we request favorable consideration for initial adoption today. Thank you.
Are there any questions for Melanie? Hearing none, is there a motion for initial adoption?
So moved, Williamson.
Have a motion for initial adoption from Anthony Williamson. Do we have a second?
Second, Dr. Coles.
Dr. Coles has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Thank you, Melanie, for those presentations.
Thank you.
We'll move now to our final item of business is the medical assistant plan, state plan amendment, therapeutic care model, public notice from Michael Smith, Director of Behavioral Health, the medical assistance plans. Michael.
Thank you, Mr. Chairman, Commissioner, members of the board. Today, I'm presenting for initial adoption an amendment to the Medicaid state plan to include therapeutic care models, TCM, effective July 1st, 2026. The therapeutic care model is a multidisciplinary, whole person-centered and community-based program designed to reduce residential treatment for the state's most vulnerable young people in Medicaid. The TCM is also uniquely positioned to shepherd this population through their emerging adulthood into stable and sustainable community placements following system age out or after 21. The TCM is built on and its programming delivered through the philosophies of evidence-based care, family-centeredness, trauma-informed care, health equity, and cultural competence. It will include a residential component where young people, youth share living space with adult caregivers and peers. It hosts the delivery of specialized services and supports to meet the biopsychosocial needs of the young people who live there. TCMs will look and be populated like houses and will not be distinguishable as institutions through either their built structures, operations, and/or their census size. TCMs will serve youth for whom in-state residential treatment is not an option, either because the member will not be admitted and/or such treatment is no longer or not efficacious, and for whom there exists no appropriate community level placement. Youth may reside at a TCM until 21 or until a less restrictive, naturally supportive placement is found. The TCM's initial population will be those in the foster care. Expansion of the program will include those not in foster care and or at risk of entering foster care. This TCM will be delivered through 2 tiers of programming intensity depending on the member's needs. Per diem rates will reflect those levels of intensity. Providers must meet enrollment eligibility requirements for Medicaid. Providers will be paid per diem to deliver this or subcontract TCM services. The TCM is modular. It contains core components and add-on options. The core and add-on components in the full model will be available in the SPA appropriate codes. Many iterations of the model can be developed and built depending on the needs of the member and provider community. Some of the core model components include high-quality assessment and treatment planning, leadership level care, management, supervision, and program administration, who cover all programs served by the agency, respite care for caregivers, family coordinator, who is the liaison between the family, leadership, and community, distinct from but coordinated with case management, staff training, supplement, for example, trauma-informed training for all program staff, transition coach, behavior aid services that can support autism spectrum disorders and mental health needs. And add-on components of the model include intensive in-home therapies, the capacity to treat the behavioral health needs of members, rehabilitation services, case management. Medical, including specialty services and dental services, will be billed outside the TCM. The model will include a modifier to the per diem for intensity service level 2. Additionally, the model will feature a modifier for members who require services in a rural setting. The per diem range for the TCM is currently $213 through $343 per day based on the composition of the service package for the member, the level of programming intensity, and their geographic location. Urban or rural. Rural per diem rates will be enhanced for rural placements. Excuse me, yes. As you'll see, the state contribution to this program is $6,028,711. The federal contribution is $11,704,097 for a total of $17,732,808. The state share of this amount is subject to further analysis as most of the model services components are existing within the state plan. An opportunity for public comment will be held on January 15th, 2025 at 1 p.m. via Zoom audio. And there will be no in-person attendance at the Department of Community Health. I would be happy to answer any questions at this time and will respectfully request your initial adoption of the Medicaid State Plan Amendment to include therapeutic care models.
Thank you, Michael. Are there any questions for Michael from any of the board members? Hearing none, is there a motion for initial adoption?
Motion for initial adoption, David Cruz.
David Cruz has made a motion for initial adoption. Do we hear a second?
Second, Kathleen Ruth.
Dr. Ruth has seconded the motion. Any further discussion? Hear none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion is approved. Michael, thank you for that presentation.
Thank you.
That concludes our items for business this morning. Does anyone have any new business that needs to come before the board? Hearing none, our next board meeting is scheduled for February the 13th. As Commissioner Carlson stated, the session begins Monday morning. So that will be a bright, shining, and fun time. And everyone stay safe in the incoming weather. Have a good day. And again, Happy New Year, everyone. Thank you for your time this morning. Meeting is now adjourned.